More changes are coming as Minnesota extends its stay-at-home order for another 2 weeks. Starting Monday, however, Governor Walz says additional businesses can reopen for curbside pickup and delivery as long as they put in place plans like providing masks and gloves for workers, use online payments, and maintain social distancing, of course. Walz says that means an additional 30,000 Minnesotans will be able to return to work beginning next week. The Minnesota Department of Health is holding its daily coronavirus briefing right now. Let's listen in.
A brief again, very briefly. Globally, as of this morning, we were approaching 3.3 million cases and 234,000 deaths. In the United States, reporting more than 1 million cases and 63,000 deaths. In Minnesota, we had an additional 596 laboratory-confirmed cases reported from yesterday. So we are now at 5,730 cases in Minnesota. That was on a very much increased testing volume. So as we've been forecasting, as we test more, we're going to see more rapid growth in the daily totals as we have been seeing. We also are announcing today an additional 28 deaths from COVID-19, bringing us to a new total of 371 deaths in Minnesota coded as COVID-19 deaths. Again, today, 24 of these 28 deaths occurred in residents of long-term care facilities. We're going to talk a little bit more about the questions that you all have raised about the percentage of deaths coming from long-term care in Minnesota later in this call. The demographics of those individuals passing away with COVID-19 include 18 in Hennepin County, 4 in Ramsey, 2 in Olmsted, and 1 each in Anoka, Benton, Dakota, and Washington counties. This reflects 6 people in their 90s, 10 people in their 80s, 5 in their 70s, 4 in their 60s, and 3 people in their 50s. And as of today, 2,282 total patients have been released from isolation. There are currently 369 patients in the hospital, 118 of them in intensive care. And we have noted in recent days the relatively lower rate of increase in intensive care patients relative to all hospitalizations, which we consider to be a positive sign. In terms of what I mentioned earlier, the ramp up in testing, which is so very important to our ability to get a truer picture of the spread of the disease in our state, and that is going to continue to drive daily numbers up at a much more rapid clip than we have been seeing, that we were able to conduct 4,124 COVID-19 molecular or PCR tests yesterday. And this is going to continue to help us not only make sure that, as the governor has said, every person who is symptomatic in Minnesota is able to get tested, but it will also help us to fine-tune and focus our efforts to track down hotspots to help stop the spread of the disease. In order to keep up this pace of growth in testing, we are going to need increasingly large shipments of testing materials throughout the state, both materials on the front end at the care delivery sites for people, healthcare providers to collect the specimens, as well as the laboratory materials needed to process those samples on the back end. We've been working hard through the State Emergency Operations Center, and Director Kelly might want to comment on this, to increase supplies. You've heard us talk about the importance of respirators and masks and gowns and gloves, but we've also been focusing on laboratory-related supplies through that effort and working with FEMA and all sources that we can find to increase laboratory supplies as well. And I just was told this morning that the state's going to begin receiving about 47,000 nasopharyngeal swabs per week through a FEMA channel, which will mean 190,000 swabs for the month of May, which will help to just, again, solidify the capacity to fully maximize all of the ability that the health systems around the state have to be collecting samples and processing them in their own labs or in the labs that they use, and then, of course, with the backbone of the university in Mayo that we announced last week. So I think that is it's very good news that the testing volume is going up rapidly. We have our eyes on how to make sure we sustain that and continue to grow it to meet all of the testing goals that we've laid out in our testing strategy. Happy to answer questions about that later in the call, but right now I'd like to turn it over to Director Chris Erzman.
Thank you, Commissioner. I'd like to talk a little bit about the many questions that we are receiving about the high percentages of deaths in long-term care facilities. We know that long-term care facilities present a special set of considerations and risks because they are congregate care settings serving residents who generally are of advanced age and often have one or more underlying health conditions. Given the nature of this pandemic, one would expect that these settings would have a heavier burden of disease and death. That is why we've been working so hard since this all started to share information, guidance, and support for long-term care facilities. We sometimes get questions about how Minnesota's numbers in this area compare to other states. We're not in a position to fully analyze what is happening nationally or in 49 other states, but there are a variety of approaches being used in other states to elevate and track COVID deaths in long-term care facilities. And here in Minnesota, we are being very aggressive about monitoring for them. For example, not all states are doing post-mortem testing that we have done on some cases to ensure that we're capturing COVID deaths. Differences among states make it very difficult to draw conclusions about the numbers we're seeing. We do think it's very unlikely that there's anything different about how the virus is behaving in Minnesota, or that there are any significant differences in the vulnerability of our long-term care residents, or how our long-term care facilities are responding compared to those in other states. We feel confident that our data on long-term care represents a good indication of how many long-term care COVID deaths there have been, and regardless of how other states are tracking, reporting, or responding, those totals show that we have to continue our focus on preventing and responding to the outbreak. And with that, I will turn it over to Director Joe Kelly.
Thanks, Chris, and hello again, Minnesota. Good afternoon. Kevin Reed is my Deputy Director at Minnesota Emergency Management, and a few months ago, before all of this started, he adopted a theme for Fridays that our organization now knows as All Good Fridays. The idea is to focus on positive things and good news stories as we wrap up the work week, and while we know that the virus doesn't care what day it is, and frankly, most days I'm not sure I really know what day it is either, I want to use Kevin's theme and share some good news stories with Minnesota today. I'll start with a very short, simple, but beautiful thing that got my day started today. And very early this morning, I made a cold call to my public safety colleague and friend, Colonel Matt Langer, who's the chief of the Minnesota State Patrol. And he picked up immediately and said, "Good morning, Joe. How can we help?" So Matt got my day off to a great start just by being positive and supportive without any condition and without any questions. And that's what being a good Minnesotan looks like, and that's made this Friday get off to a good start. But in other good news, more technically or bureaucratically, about a month ago when FEMA issued our major disaster declaration for the pandemic, Governor Walz asked them to authorize an additional program to help take care of people. You might recall we asked the federal government to provide funding support for what's called crisis counseling assistance. And that program helps individuals cope with the psychological and emotional effects of an incident like the coronavirus pandemic by providing community-based outreach and educational services. It supports short-term interventions to help us all understand our current situation and our reactions to it, mitigating stress, reviewing recovery options, promoting the development and use of coping strategies, and just building other emotional support and encouraging us all to make connections with people and agencies who can be helpful to us. So I think by this point in the pandemic, we can all relate to and tell our own stories about stress, anxiety, fear, and all the other emotions and reactions that have come with this pandemic. Things like losing a job, worrying about paying your rent or your mortgage, not being able to go to school or have a proper graduation ceremony, that lost sports season, canceled or postponed family events, and of course, worst of all, the death of a precious loved one. Those are all among the many stressors caused by the outbreak, and I'd be surprised to meet someone who isn't feeling some of those effects. So that's why we asked for that program. Our request has been, quote, under review, close quote, for the better part of a month. And the good news is I think we should very soon get notified that our request has been approved. On Tuesday, the President delegated authority to authorize those programs down to the FEMA administrator, and I think ostensibly to get those requests from dozens of states like ours out of that usual review process and move them forward so that we can start helping people that need some support during these times. And I know that the FEMA administrator is now quickly working through those requests. I know they have everything that they need from Minnesota, and I know that we meet the criteria for approval. So I think we will know very soon that this important program will be available to Minnesotans feeling the strain of the pandemic. These support services will be provided at no cost and are really available widely to anyone impacted by the disaster. Our State Department of Human Services has managed this program in the past, and they'll work with mental health providers and others to conduct outreach to find those who need support. And we've been working on this for the last month or so on exactly how to conduct that outreach and deliver effective services while maintaining social distancing. I think we've all heard about telemedicine and about things of that sort that have been had been adapted during the pandemic, and I imagine that this program is going to be the same way. So among the good news this Friday, then, is that help should be on the way very soon to those who need some mental or emotional support to cope with what we've all been going through. And I look forward to confirming that with you all very, very soon. So I'll kick things back to Mike Schomer now for the Q&A portion. Mike?
Thank you, Director Kelly. We'll open it up for questions now, and as we do, I'll ask reporters to limit questions to one primary and one follow-up, and that we limit the number of questions from each outlet.
Well, you've been watching today's COVID-19 daily briefing from the Minnesota Department of Health today. Governor Walz not participating today. Instead, we're just hearing from commissioners, the state health commissioner as well as the commissioner of the state emergency management. Not a lot of new information today, just additional numbers from Jan Malcolm from the health department saying that Minnesota now has 5,730 cases and that we have experienced 371 deaths and that 2,282 people have recovered and have been released from the hospital. So updated numbers there today from the state. We'll continue to track developments this afternoon and bring you updates as they happen on our WDIO website, our mobile app, and we'll of course bring you the latest on WDIO News tonight.
This has been a WDIO News special report.